Hello everyone, we'll be discussing about infraorbital nerve block, also known as anterior superior alveolar nerve block. We'll be discussing this block under following headings, that is nerve anesthetized, area anesthetized, indications, contraindications, advantages, disadvantages, technique and complications. Nerve anesthetized are the anterior superior alveolar nerve, middle superior alveolar nerve and the infraorbital nerve with its terminal branches, that is inferior palpebral, lateral nasal and the superior labial. Area anesthetized are the pulp of the maxillary teeth from central incisors till canine, and in 72% of the cases it also anesthetizes premolars till mesobuccal root of the first molar, buccal periodontium and the bone of the same region, and the extraoral soft tissues by its terminal branches, that is the lower eyelid, lateral part of the nose and the upper lip. Indications: dental treatment or the dental procedures requiring more than 2 maxillary teeth, or in case of contraindications for supraperiosteal injections, that is acute conditions like an inflammation or infection. Also in cases where supraperiosteal injections are ineffective because of the dense cortical bone. Contraindications: when dental treatment is required only for 1 or 2 teeth, so we can go for local infiltration. Advantage: infraorbital nerve block is comparatively a simple and a safer technique. Disadvantage is fear of injuring to the globe or the eye by the administrator while giving the infraorbital nerve. Coming to techniques, there are 2 main techniques, intraoral and extraoral technique. Extraoral technique is directly hitting to the bony landmark, that is the infraorbital foramen, through extraoral skin. An intraoral technique has 2 approaches, that is bicuspid approach and central incisor approach. We'll be discussing about bicuspid approach. So, techniques. What are the landmarks? Landmarks for infraorbital nerve block are supraorbital notch, infraorbital notch, midpupillary line, infraorbital notch coming around 5 to 10 mm below. Will be feeling a depression, that is infraorbital foramen and the mucobuccal fold. Area of insertion is the height of the mucobuccal fold of premolar region. Here, like the area of insertion can be from any of the teeth, that is from the central incisor till second premolar, but the shortest distance for reaching the target area is from first premolar. So the preferable site of area of insertion is height of mucobuccal fold from first premolar. Then needle orientation. While giving infraorbital nerve block, the bevel of the needle should be facing towards the bone, so that while injecting the anesthesia, injecting the solution, we can directly drop the solution into the foramen. The bevel should not be away from the foramen because it can cause the failure of the injection, or we can hit the extraoral tissues, or we can go inside the eye. Target area is the infraorbital foramen below the infraorbital notch or the infraorbital rim. Coming to procedure. Procedure involves the patient position and the operator's position. Patient position should be neck extended, like the maxillary occlusal plane should be at a 45-degree angulation to the floor. Operator should be standing around on the right side and at 10 o'clock position for giving block. So after filling the syringe with LA around 1.5 ml, we'll be locating the landmarks. After locating the landmarks, coming to the infraorbital foramen, the thumb should be there, and with the rest of the finger we should retract the lip and pull the tissues so that we can see the height of the mucobuccal fold. After retracting and seeing the height of the mucobuccal fold, we should insert the needle from the first premolar, and the bevel should be facing towards the bone. Insert needle parallel to the long axis of the tooth. Advance the needle slowly till it reaches the landmarks, till it hits the target area. After hitting the target area, we should aspirate in 2 planes. What should be the depth of the needle penetrations? The depth of the needle should be around 16 mm, but it varies in patient to patient, because some of the patients have high mucobuccal fold and some may have shallow mucobuccal fold. So according to depth of the needle varies, but generally we should go at around 16 mm of the depth. After aspirating in 2 planes, we should deposit LA around 0.9 to 1.2 ml at a rate of 30 to 60 seconds slowly. Feel the solution. When we are depositing the solution, the thumb or the finger, we should feel the solution which is injected. After injecting, slowly withdraw the needle syringe, and we should wait, or we should apply the finger pressure for about 2 minutes so that the solution is distributed along the foramen area. So after giving this, we should wait for 3 to 5 minutes for the onset of the action of the block, and then check the subjective and the objective symptoms. Subjective symptoms are the tingling sensation or numbness over lower eyelid, lateral part of the nose, upper lip, and the surrounding intraoral and intraoral soft and hard tissues. Objective symptoms, different methods are there, will not be seeing that. Now coming to the complications. Infraorbital block has very rare complications, that is hematoma. If it occurs, we should not worry. We should apply a firm pressure over the hematoma area for around 2 to 3 minutes, and it will settle down on its own slowly. Thank you.